Saan na ba tayo? Ito, moving a little. Now, we will go now to body movement and alignment for the patients. There are two basic principles. In moving the patient, ang isang principle niya is you have to maintain the correct anatomic position. You have to change the position frequently of the patient. Why? Maintaining the correct anatomic position with a hazard improper alignment and interference with circulation may lead to pressure ulcer. And also, muscle cramps are possible contractures. Fluid collection in the lungs also. Now, changing the position of the patient, importante yung i-change natin from time to time every 2 hours, because if you will not change the position, the patient may lead to have this, yung bed sore, nagkaka-bed sore yung patient natin. If you will not change the position frequently. And also, muscle cramp, nagkakaroon ng muscle cramp yung pasyente. At the same time, yung mga possible contractures niya, yung mga nakalagay sa kanya, kunwari may tubo siya, meron siyang, anong pangalan nito, dextrose, yun ang na it may help to trigger them para magkaroon sila ng muscle cramps. Kasi straight yun eh. Naka-splint yung kamay nila. So, pag hindi nila ginagalaw yun, mamamanhid yung mga kamay nila at masakit yung muscle cramp. And also, pag hindi natin i-change ang position niya from, turn the patient from side to side, magkakaroon siya ng fluid collection in the lungs. Kasi, ang nangyayari niya, nagkakaroon tayo ng sweat. If nagkaroon tayo ng sweat, nababasa yung likod natin. At the same time, pag hindi natin i-change from other side also, yung pasyente, nagkakaroon siya ng nagkakaroon na siya ng mga cough, nagkakasipon na siya. So, dapat turn to side natin, lagyan lang natin siya ng pillow sa likod ng pasyente. Tagilid lang natin siya. And then, i-contract kasi yung mga nakalagay sa mga pasyente at saka yung pag-correct ng positioning ng pasyente. Now, eto yung figure correct standing body alignment. Dapat straight yung natin, yung neck, straight yung back natin, yung arms is relaxed at the side, and it is head up, eyes is straight ahead, chest out, abdominal muscle is tucked in, the knees is straight and flexed, yung feet niya is straight also and forward. Ganito yung correct body alignment. At the same time also, there is a correct sitting body alignment. Ito siya, ganyan ang tamang pag-upo para hindi tayo magkakaroon ng back pain also. And also with the patient, ganyan ang proper body sitting body alignment. Now, we're talking about the pressure ulcer. Kasi last time, if you will not position the patient, nagkakaroon siya ng pressure ulcer, or we also called as a decubitus ulcer or bed sore. Ito, nagkakaroon siya, it occurs when the pressure on the skin causes the area as a local tissue. So, kung nagkakaroon siya ng yung skin mo, nalolocalize na yung tissue mo, nagkakaroon na ng necrosis, o una kasi nagiging blister siya, nagiging brown, hanggang namumula-mula na siya, hanggang mamaya naging na siya, namatay na yung yung skin tissue mo. It occurs most oftenly between the bony prominence and external surface. Usually ito, yung kaya nagkakaroon ng necrosis, naka-attach yung mga muscles natin sa mga malalaking buto. Katulad ng mga joint natin, yung foot natin, yung sacrum, dito sa lumbar, dito sa may puwetan, yun. Malaki ang bony parts yun. Once na hindi mo pinosisyon yung pasyente, you turn to side, it can cause a decubitus ulcer or bed sore. And maybe it caused by shearing as a force and applied downward and forward on tissue beneath on the skin. When the patient is lie down on the chair, kailangan meron siyang meron siyang nakalagay na pangtulong sa pasyente pag once na meron siyang anong pangalan nito, pressure ulcer. Ito yung itsura ng pressure ulcer ng patient. Kadalasan, ito yung mga pasyenteng na matagal nang nakahiga sa kama. So, ito yun, yung pwede mangyari sa kanilang paa, sa kanilang may likod nila, sa may puwet nila, ganon. So, it's very painful yung ganitong pressure ulcer para sa mga pasyente. Etong bed sore na ito is localized in an areas of necrosis of the skin or subcutaneous tissue at nagkakaroon siya ng pressure once na masakit siya. What are the factors that contribute to develop a pressure sore for elderly patient? Ang mga factors na na siya nito, number 1, pag yung yung bed making mo hindi maganda, hindi maayos, crumpled siya. So, nagkakaroon niya ng bed sore. Nag-i-start yan sa kunwari Makati hanggang Makati naging brown hanggang naging blister hanggang namula na siya hanggang naging na siya, nagkasugat na siya. Ganon, nagkaroon na ng crack ng skin mo, nagsugat na siya. Ayun. Number 2 pa, bukod doon sa bed making na hindi natin tina-turn the patient onto side. Or hindi natin ini-encourage yung patient na na tumayo or tulungan yung sarili nila. Dapat at least kahit na sila, pwede silang tumayo or umupo. Hindi yung parating pero mas maganda pag ang pasyente ay naglalakad. Kasi pag once na naglakad yung pasyente, kailangan kasi ng air para matuyo yung ang pangalan nito, yung bed sore din. And at the same time, what are the body site most commonly involved? Ito nga yung mga malalaki katulad ng mga joints, dun sa may sacrum area, sa may mga foot mo, ganon. So, yun ang pinaka-dangerous part na talagang malapit kang magkaroon ng pressure ulcer pag hindi mo iningatan yun. Usually, ito rin yung mga heels, elbow, hips, and other base of the spine. They often develop gradually, but it can sometimes form in few hours. Pag hindi mo siya kasi mainit yan eh. Once na hindi mo inangat siya, hawakan mo lang yun, pwede ka nang magluto ng itlog. Ganun. Mainit talaga yung pressure ulcer na yan. Isa pa, bed sore, ito, pareho lang siya. Now, nursing diagnosis for problems of body movement. Kadalasan, ang mga it is a wrist injury, and it's also impaired physical mobility, risk for impaired skin integrity, and impaired walking. So, kadalasan ang problema pag sa body movement ng mga pasyente, very risk na sa injury kasi they cannot walk, they cannot stand, they cannot help themselves. Dependent sila, especially those who are already confined in the bed for a long time. And also impaired physical mobility dahil nga hindi na sila gaano nagmumubula ng exercise, hindi na impaired na rin yung nila, hindi na sila gaano nagkikilos. And impaired skin integrity. Once na yung parati kang nakahiga, nagiging yung circulation ng ano mo, ng blood sa lahat ng system mo, sa skin mo, nagiging impaired na rin kasi risk ka na sa ano, sa bed sore or any dryness of the skin or hindi na maganda yung skin mo, nagda-dry siya. And impaired walking also. So you need to therapeutic exercise na ginagawa natin is prevent the injury or immobility. You have to help the patient range of motion, i-move mo sila. Hindi naman yung hindi masyadong nag-ano ng force agad-agad, but at least ano sila, na-exercise mo na itaas nila yung kamay, mga paa, naikot yung ano, yung neck, ganun. At least nakakapag-move pa rin sila. Restore the function of the muscles, the nerve, the bones in the joint. You have to help them to restore that the functions of their muscles, nerves, bones, and joint. Dapat ma-overcome nila yung ano, yung illness ng katulad ng mga pressure sore. At the same time, makakapag-move siya. Yung joints niya, hindi ba yung skin integrity mo ay hindi siya maganda, yung na-improve ba? You have to prevent deformity and stimulate circulation. Yeah, i-prevent mo ang deformity niya like giving them yung right na positioning at saka yung alignment ng katawan nila, i-straight mo sila, i-stimulate yung circulation. Pag may yung pasyente ay nakahiga parati, you have to back rub the patient, yung sa likod niya, i-tap mo siya para magkaroon ng circulation. Kadalasan, once na every turning the patient every 2 hours, after that, you have to tap the back of the patient para lumamig din kasi mainit yung uni. At least lumamig man ng konti at saka nag-circulate konti yung katawan niya. Every 2 hours yan. And build tolerance and endurance for the patient. Kadalasan, doon sa mga nurses, ang sabi nila, if pag binigyan ka ng pasyente, and the patient, katulad pag bedridden siya, okay pa siya, wala siyang bed sore, ganun. And then, pag hinawakan mo siya, tapos nagkaroon ng bed sore yung pasyente, ang assessment nila doon ay poor nursing service or kasi hindi mo na pa yung pasyente. Hindi imbes na gumaling siya, naging progress yung health niya, nagkaroon pa siya ng dagdag, nagkaroon siya ng pressure sore. So dapat yung pasyente natin ay gumagaling sa atin. Okay? And then also in giving service to our patient, we have to decide how to manage the patient, the positioning, whether you can delegate or the task of the assisted personnel. Katulad niyan, kung nag-iisa ka lang, maghanap ka ng kasama mo para ay yung position ng patient, or you can delegate sa bantay kung kaya niya. Kung hindi mo kaya, pwede ka rin tumulong sa kanila. And for home setting, you must also consider when planning the care of the patient. You have to plan for the care of the patient. Kasi pag nasa home base ka, ikaw lahat pupunta ka lang pagka hahanap ka lang ng kasama mo pag andyan na yung mga, pag may case ka o kaya for clinic consultation siya or may appointment sa doktor. So, ikaw mismo ang mag-aalaga sa pasyente. Unlike pag nasa hospital, maraming tumitingin sa pasyente. Also, the goals and expected outcome. The patient may also experience pag nagplano ka, the patient will experience no muscle skeletal injury. And you have form a level of mobility that will retain within 6 months. Dapat meron siyang exercise na makaka-move siya para ma-retain yung niya, makaka-move siya at saka makikita mo na hindi na, kasi pag ang muscles hindi siya gumagalaw, nagiging stiff yan. At pag hindi siya naging stiff yan, sometimes nagiging na siya, flaccid, at saka lumiliit yung mga muscles, nagiging atrophy yung mga muscles natin. Pag once na hindi natin ine-exercise, lumiliit yan at nagiging flaccid na siya, at saka atrophy. Skin integrity will remain intact when the patient is on bed rest. So dapat parati natin alagaan yung skin ng patient natin, lalo na pag mag-bed rest natin. It is very important when pag nag-rest yung patient natin, at least ma-lotionan natin sila, ganun. Kasi ang skin kasi ng pasyente, pag nagiging dry yan. Kasi kulang din sila ng tubig. Ang kadalasan may mga ibang pasyente na na hindi na nakakainom, only through dextrose, like that. Or sometimes yung may mga outpatient din, makikita mo kasi yung pasyente na nagpo-progress pagka maganda ang skin niya. Hindi naman yung ibig kong sabihin yung skin na hindi siya nagda-dry, nagka-crack, ganun. Patient will experience injury while ambulating. So if you have a good management and you exercise the patient, you encourage, and then pag nag-walk na siya, nag-ambulate na yung pasyente, hindi siya makakapag-experience ng mahirapan siyang maglakad, may nararamdaman siyang sakit or any injury. The patient will not feel that one or experience. Patients should have a full range of motion, exercise actively, or possibly perform several times a day. Yung nga yung sinasabi ko, dapat may exercise din yung yung patient natin. Nakahiga man siya o nakatayo or anything, at least minumove niya yung kamay niya, yung leeg niya, yung paa niya, ganun. And how this goal align with institutional standard? Kasi eto dapat naka-assign, naka-take down notes sa mga nurses notes natin. So kailangan i-perform natin to para matulungan natin yung pasyente mapalakas at saka madaling gumaling. And also the learning objective for clinical practice, we will able to describe the proper method of transferring of the patient between wheelchair and bed. So nasa lifting na tayo ngayon. So when you transfer the patient from wheelchair to bed, dapat meron kang proper method noon. And correctly position patient in the following position. May mga different types of position kasi ang mga patient. Like for example, the supine position, prone, Fowler position, and Sims position that assist the patient from sitting up, out of bed, and from bed to out of bed. Now, also, you will able to demonstrate the passive range of motion, which ROM, exercise for a patient, and correctly transfer the patient from wheelchair to a bed. Transfer the patient from bed to stretcher. You will be able to demonstrate also the correct technique to ambulate the patient and to break a fall while ambulating. Now, the positioning. Positioning is very important for us as a nursing aide or a caregiver or as a nurse, because that's the way where the patient will be able to gain strength. Pagka ang position kasi ng pasyente, pag parating nakatihayak lang at saka mahirap siyang gumaling. At the same time, ang positioning din during treatment, katulad ng meron tayong surgery. Surgery may depends what kind of position na gagawin. It's either na nakahiga ba siya, nakaupo ba siya, depende, naka-triangle position ba siya, ganon. So, talaga importante ang positioning also. Positioning relieves the pressure of the body prominence in other parts. It decreases the patient risk of developing bed sore. Positioning also prevents contractures, deformity, respiratory problem. So, ipiniprevent niya yung mga contractures na sa atin kasi pagka once na may mga contractures natin, nagkakaroon ka ng namamanhid ang mga kamay mo, mga paa mo, nagkakaroon na siya ng deformities dahil nga prolong na hindi na siya naggagalaw, nadideform na siya. Sometimes nag-atrophy ang mga muscles natin, ng skin natin, even respiratory problem. Because of one position, pag nakahiga lang siya, especially if you have a patient who has a problem of a cardiac problem or any what do you call this one, asthma patient, they need to sit down kasi they have difficulty of breathing, the heart failure, ganon. Talagang kailangan nila um, a good position for them. Positioning improve circulation. Once na katulad na when the patient is in shock and nakaupo lang siya, nakahiga siya, sometimes in the operating room, if the patient is in shock, inano namin siya, iniiba namin yung position niya para yung blood circulation pupunta sa brain niya. Kasi pag naging hypoxia yung pasyente, wala nang blood circulation sa brain niya at napunta sa lower part ng body niya, magiging na siya. So pinaposition namin yung pasyente pabaliktad. Yung ulo niya nasa baba, yung paa niya nasa taas. Pagkano naman, depende nga sa position or any illness of the patient. Now, how can a nurse maintain patient privacy during positioning? Now, it's from proper draping. Diba, dito sa positioning natin, we have different types of blankets. So, pag i-position mo yung pasyente, huwag mong i-expose yung other parts ng katawan niya. There are so many drapes niyan, ang daming mga blanket. You have to cover the patient para ma-maintain yung privacy nila. Now, there are common position and variation of positioning a patient. Number one, we have the supine. Patient is lying on her back. And number two is Fowler position. Ito naman ay supine with the head over bed elevated 60 to 90 degrees. And then semi-Fowler position, supine position with head over bed elevated 30 to 60 degrees. And then lower Fowler position, supine with the head over bed elevated with 15 to 30 degrees. So ganyan yung niya. Ganito yung itsura niya ng Fowler position. Kadalasan yung ganitong position yung mga cardiac problem, may respiratory problem kasi nahihirapan silang huminga. Ito yung high Fowler's position, which is 90 degrees. And then standard Fowler position, 60 degrees. And then semi-Fowler position, it's 45 degrees. And then the lower Fowler position is 30 degrees. Now, the common position and variation, for what condition or purpose are these positions to be used? So, kadalasan ang supine position after spinal surgery or after administering spinal anesthetic. Ito yung position ng pasyente on supine. And Fowler, semi-Fowler, or lower Fowlers improve cardiac output or respiration, promote urinary and bowel elimination. Kasi nga they have nahirapan silang huminga, shortness of breath. So you have to encourage the patient to sit in a Fowler position. And why is elevated of the knee above 15 degrees? That is contraindicated to elderly and postoperative patient. Of causes decrease the circulation of lower extremity. Kasi kadalasan pag once na elevated yung knees niya in 15 degrees, lack of circulation na nasa na siya decrease yung circulation mo nasa lower extremities katulad ng sinabi ko. Dapat pag once na the patient will have a shock. So ang ginagawa, binabaliktad siya para yung circulation ng blood mo pumunta rin sa brain mo. Katulad din ng yung varicose vein. Pag maghapon kang nakatayo, ang sakit kaya ng paa, nagkakaroon ka pa ng cramps ng paa mo, or nagkakaroon ka ng mga spider web, o kaya yung mga vein mo nagkabuhol-buhol na. And after a while, when you put, masakit siya, but pag itinaas mo yung paa mo, nare-relax yung nare-relax yung vein natin. So parang ganun din. Kasi lahat ng pressure, lahat ng dugo nasa baba natin, so dapat itaas natin para umakyat din siya. Now we have the dorsal recumbent position, supine with knee flex and feet flat on bed, used for many procedures and examination. Itong supine with knee flex, dorsal recumbent. Kadalasan ginagamit ito sa ibang procedure at saka examination. Dorsal lithotomy position, feet with stirrups spread farther apart. Usually yung dorsal lithotomy position, ginagawa ito sa mga pelvic examination. Katulad ng delivery or buntis ka, ganon. So, ayun ang position ng dorsal lithotomy position. So, what is the dorsal lithotomy position? Patient lies on her back, legs are separated, thigh are acutely flexed on abdomen and legs, and on thigh buttocks brought on the edge of the bed or the table. So, ganito ang itsura niya, yung dorsal recumbent. Kadalasan ito pag meron kang IE or IE examination, kung saan na ba yung head ng bata, pag sa delivery ba ganun. Or sometimes if you have any problem pag meron kang hemorrhoids, ganito din yung position niya. And also this lithotomy position, ito na yung pag sa delivery mo. And also, kadalasan ito sa pag meron kang hemorrhoidectomy, ganito din ang position niya. Now, common position and variation in side-lying lateral. Though the patient lying on her side, it's alleviate the pressure on the bony prominence of her back. On the oblique side-lying position, remove pressure from the shoulder and hips. It is easier for the patients. So, ang niya, oblique side-lying position siya. And Sims position is a variation of side-lying used for a rectal examination or insertion for a tube or suppository. Kadalasan itong Sim position ay ginagawa pag nagkakaroon tayo ng enema. Pag nililinis natin yung rectal ng pasyente natin o kaya sa para ilabas malinis ang pinaka-abdomen natin for some examination also. Or when we put suppository, Sims position natin yung pasyente para agad-agad makapasok yung suppository. Ito yung side-lying position. Ito yung Sim position, pinatagilid siya. Now, the common position and variation in prone position. Patient lying face down, often used for the patient with spinal cord injury, and not generally well tolerated. Kadalasan ang prone yung nakadapa, ang sabi niya. Ito yung naka-face yung mukha mo. And kadalasan ito pag ang pasyente ay may spinal cord injury. And knee chest position, face down with chest, knee, and elbows resting on bed, and used for rectal examination also. This knee chest position. Patient on prolonged bed rest may develop internal rotation and deformity of hips. Ayan po yung knee chest position and prone position. Ito po yung prone position. Nakadapa siya. And the knee chest position. Ito po siya. Kadalasan also, ang niches position, ginagawa yan pag mayroon kang dysmenorrhea. It relieve also this niches position if you do this one during your period and you have this, ang pangalan, you have this dysmenorrhea. Now, the common position devices. Number one, it's the pillow, used to support the body or the extremities. And we have also boots, or splint. It maintains dorsiflexion. Kadalasan pag may mga boots or pins na anuhan yung nami-maintain yung position ng kamay natin. Pag may pilay ka, nilalagyan ng splint yan. Footboard or high-top sneaker. Use of footboard when the patient is in dorsal position to prevent foot drop. Naglalagay tayo ng footboard kasi para ma-prevent ang foot drop. And also trochanter rolls. It prevents external rotation of the leg and it prevents deformity of the hip. External rotation and by the use of a trochanter roll. Meron tayong mga figures na mga ito. Yan ako mamaya. Some common devices also, we have the sandbag. A sandbag used to immobilize an extremity, provide support, and maintain body alignment. Yung sandbag kasi inilalagay para hindi mag-move yung ano mo. Mag-move kung ano man yung paa mo o yung kamay mo, anything. Support para ma-maintain yung body alignment mo. And hand roll also help to prevent contractures and prevent dorsiflexion of the wrist. We have also the trapeze bar or side rails or bed boards. Kadalasan ito, it enhance patient mobility, provide patient safety, and support patient back. Yan yung trapeze bar or side rails or bed board. Now, moving the patient in bed. Using a lift sheet, it requires at least 2 people standing on the opposite side of the bed. Both face the bed and use the sheet to move the patient. And in bed, moving it is the most important factor of the patient and nurse. Moving the patient is the very important factor for patient and nurse. The nurse must use good body mechanics and balance. And you have to communicate with the patient and ask the patient to help guidance if it's necessary. You have to instruct also the patient so that you can move easily and without any strain on your part. Ito yung trapeze bar, ginagamit para pag-lift siya. And this is also a trochanter roll, nilalagay para hindi maanuhan yung external rotation ng feet mo. Now, we have also lag rolling, turning the patient a single unit, body alignment maintained at all times. Used to change bed linen, yung lag rolling, we usually do that one in changing a bed linen or doing a bed making, which is like it's not open, closed bed or occupied bed. Yan ang lag rolling. We can perform with or without lift sheet. Requires 2 people if patient cannot turn to herself or leave pillow under the patient's head. Ganito siya ang lag rolling of a patient using a lift sheet. Ganyan siya. Ililipat mo siya kasi dito, kukunin mo yung bed sheet para maayos siya. Ite-turn mo lang yung patient, i-lag roll mo siya. Ayan, lifting. Ganyan ang itsura niya. And then, a patient may transfer independently or require different level of assistance. Always dangle a patient at bedside before transferring a wheelchair and observe for dizziness or nausea. You have to always check the patient if the patient is okay. If when you transfer from bed to wheelchair, wheelchair to bed, because sometimes patient have dizzy, lalo na pag tumayo sila because of prolong in the bed. So you have to remember to lock the wheels of the wheelchair or the gurney before attempting to transfer the patient. Ilak mo even yung ano niya, yung bed niya, kasi usually right now we are using yung bed na meron ng ano, yung may gulong, so that we are using that one when the patient is uh, have an OR like that. So we do not use already or transfer the patient, remove the patient out of bed. But we are using it already. Itutulak mo na lang yung bed niya, dalhin mo na sa operating room. Yun na yung uso ngayon. So, ang kagandahan nun, hindi ka na mahihirapan. But when you transfer it like that, from a wheelchair to bed, kailangan nakalock siya. Kasi mag-move yun, patay ka, di bumagsak yung pasyente. Stretcher used for transporting a patient who is unable to sit in a wheelchair. So, katulad ng stretcher, ginagamit natin para sa mga pasyente, para yung mga hindi sila unable to sit in wheelchair. Naka-stretcher lang sila. It's either lift equipment or two nurses should transfer a patient to a wheelchair if the patient is unsteady, weak, or heavy. Now, these are the things to remember in transferring the patient.